how many people are not going to be helped by the Affordable Care Act, even if all of the reforms go well, even if healthcare.gov gets up and running, even if they correct the back end of the IT system as well as can be done? I mean, what can be done for these people?
This is clearly a terrible gap. The population that's under 100% of poverty that was intended to be eligible for Medicaid and therefore not eligible for subsidies, but now falls through the cracks in states that choose not to expand up to 100%. It is surprising to a simple economist who lacks the insight of a political scientist or public policy, public perception analyst that more states aren't expanding, given that the resources are coming exclusively from the federal government for several years and then almost exclusively from the federal government. In essence, the residents of those states that don't expand are paying federal taxes just like everywhere else, but they're not getting the benefit for their residents of expanded Medicaid. It seems clear to me that Medicaid costs money, that it doesn't save money, but it also seems clear to me that it is vital to the health and well-being of populations who are on the program. So it's hard for me to explain not expanding using any kind of cost-benefit analysis, and it really is a tragic gap for that type of family.
You know, it's when we were working in the Senate on writing and passing the law, we heard so many times accusations that we were engaging in healthcare rationing that it kind of started to just bounce off you and you just didn't absorb it anymore. But the way the law was written, this family would have been helped, and this family would be eligible for Medicaid beginning on January 1st. And it didn't because of the Supreme Court decision. And so we face the ironic situation that beginning on January 1st, the only population of American citizens who doesn't have some guaranteed access to affordable care will be low-income adults in households that have incomes below the poverty line. People will die because of that policy failure. And it is, to me, the most insidious form of rationing anyone could ever envision, that only poor people are kept out of the benefits of this law. And that is what we're facing. And ultimately, that is why I believe that when we get over the furor, the political furor of Obamacare, as some of the governors who've taken such a hard stance against it begin to leave office and are replaced by others of either party, that'll be the opportunity for states to say, okay, let's take a fresh look at this. Let's see what's going on in other states. And I do believe we will get there, and I don't think it's going to take that many years.